Good morning, sir. I'm John Vince, and I'm going to ask a few questions about your visit today. Everything that you will tell me is confidential. But first, I'll take your vital signs. So, what is the purpose of your visit to the doctor today?
I got these wounds here on my penis, doc.
Oh, I see. Sir, before we proceed, may I ask for some more general information about yourself?
Yes, doc.
When did you start noticing them, sir?
About 2 weeks ago, I felt itchiness and pain whenever I urinate, doc.
Oh, do you feel any other symptoms? Where did you feel this pain and itchiness?
On my hair, doc, I feel itchiness.
Oh, okay. Did you do anything to ease what you felt? Alright, sir. I think that will be enough for now. Thank you so much for your time. The doctor will see you soon.
Ang tagal. Miss, matagal pa ba to?
Sorry po,
Ay, hindi. Ang tagal-tagal ko na dito. Mag-alas 12 na. Gutom na ako. Saka ang tagal-tagal.
ma'am, ano po ba ang number ninyo kanina? Baka naman po wala po kayo rito nung tinawag ang pangalan ninyo.
Number 11 ako. Kanina pa yun.
Ma'am, naintindihan ko po ang frustration ninyo, pero wala po kayo nung tinawag kayo ni doktora. Kayo na lang po ang sumunod, ma'am. Okay lang po ba sa inyo?
Okay.
Excuse me, doc. Can I come in?
Yes, sure, come in. Sit here. Hi, Mr. Ravichandran. I'm Dr. Fadaragaya. I will be your doctor today. How would you like me to address you?
Ravi is fine, doc.
To be able to help you, I need to take a history which will involve asking you questions about your health and social circumstances. Is that okay with you?
Yes, doc, as long as it helps me.
Okay, before we start, I just want to confirm your details. So, it's Mr. Ravichandran, 25 years old, single, and currently residing at San Fernando City, right?
Yes, doc, you're absolutely right.
Okay, great. So, can you tell me what's the reason for your visit today?
I slept with someone recently, but only once, and I did this. I haven't told my girlfriend yet. I don't know what to do. What will I say to my girlfriend about this?
Someone else is your partner, or
I think she's from the red light district.
she's a sex worker?
Yes, doctor. She's a sex worker.
I see. So you had sex with a sex worker and had vesicular eruptions in your penis. Now you're worried that your girlfriend might leave you if she finds out. Why do you think it won't go away?
Doc, I consulted in the past, said it won't go away. It will keep coming back. The doctor didn't help me at all, and the medicine is so expensive.
When did you first have those vesicular eruptions?
Doc, I think about 2 weeks ago.
What other signs and symptoms did you feel in the past 2 weeks?
I feel the eruptions, which is so painful. It's itchy, and I also have fever, doc.
So the eruptions are painful and itchy, accompanied with fever, am I right?
Yes, doc, you're right.
Can you rate the pain, 1 being the lowest degree to 10 being the worst degree of pain that you feel?
Maybe around 8, doc, and it affects my daily life. I also have trouble sleeping because of these eruptions. When my girlfriend finds out, she will leave me. I don't know what to do. What Anna will say. I was so stupid.
You seem to be very worried about the situation.
Yes, doc. My girlfriend has been very faithful to me. ever since we started dating. The sex I had with the sex worker was unintentional, and my friend just challenged me since I'm drunk and I'm so wasted.
So, can you tell me when was your last sexual contact with a sex worker?
I think around 3 weeks ago, Doc.
Can you recall other sexual encounters after that?
After that, I only had sex with Anna, my girlfriend, of course.
What protection did you use during your sexual contact with the sex worker?
None, Doc. As I was so drunk and wasted, I cannot think straight on that night.
How about with your girlfriend Anna? What protection did you use during your sexual contacts?
Siyempre, a condom, Doc.
Did you use protection in all of your sexual contacts with Anna?
Yes, Doc. We always use protection because we are not ready to build a family yet.
Alright, let's have a look at you first and see what we can find.
Okay, Doc.
So Ravi, this is Dr. Blaze. She is our clinical clerk and she will be preparing for our examination. Doc Blaze, please take care of Ravi. Thank you.
Yes, Doc. Good morning, sir. I am Clinical Clerk Blaze and I will be preparing you for the examination. Can you please lie down, sir, and kindly remove your pants?
Yeah, sure, I will, but does this have to do anything with my girlfriend knowing this situation and about my situation? I don't want this to spread out because I'm so anxious about people knowing my situation around my place, so it won't be good.
Ah, we will try our best, sir, not to make you feel uncomfortable. But you need to fully cooperate with us, especially to our doctor. She needs you to be honest as much as possible, sir.
Yeah, I'm okay with that, but I'm really like concerned about does this thing anything need to be done with my girlfriend because I don't want her to know this.
If the management plan warrants the need to inform other people, then we will need to inform some people about your condition, sir. So now I will call the doctor. Please settle down, sir, and we will examine you. Is that okay?
Okay, I'll cooperate 100% with that.
Hi Ravi. So how are you feeling right now?
I'm feeling kinda okay right now.
So we'll now start the examination. Are you okay if the Blaze is with us?
Regarding that, I don't want a crowd here seeing me, so if I wish, can I be examined by a single doctor?
Okay, sure. Doc Blaze, we'll see you later.
Okay, doc, no problem. I'll just stay outside.
Thank you. So let me see the affected area. I will examine it and let me evaluate, okay? Are you still feeling uncomfortable?
I'm kind of feeling uncomfortable, but that's not the point. I'm more worried about my girlfriend knowing this situation and my community knowing this also. They'll treat me differently, and I don't want that to happen.
Okay, I understand that's your concern, but we'll talk about it later, okay? I noticed that you look down while pulling your shirt to cover your groin. Are you scared, or may I know your the reason why?
No, doc, I'm not scared, but of course, you know the gender differences, and I'm being examined by a lady doctor, so I know you. I think you can feel me.
Okay, I know that, Ravi. But is it okay if we continue having me as your doctor?
Yes, pa, I'm
Okay,
okay with that.
I'll continue. Okay.
Okay, doc, how is the situation down there? Will you be able to help me with my condition? I'm just so worried and nervous because my girlfriend will be worried if I have this kind of situation, and I hope she doesn't find it out. Is there any way that you can or we can keep this as a secret?
All right, Ravi, calm down. Are you worried that this will not go away, or are you worried that your girlfriend will find out?
Actually, doc, I'm worried of both of it. I'm worried about my own health, and I'm worried about my girlfriend knowing this situation.
Okay, Ravi, let's continue this outside, and you may put back your pants.
Okay, doc, thank you.
So, Ravi, based on my findings of your vesicular eruptions in your penis, we are suspecting that you have herpetic infection, probably sexually transmitted. We will do further tests, like blood test, Ravi, so for us to confirm this. Does your girlfriend have the same lesions that you have now?
Doctor, to my knowledge, I don't think so. I had sexual contact with her 2 days after the sex worker, but she doesn't have any, to my knowledge.
You mentioned that you had sexual contact with a sex worker 3 weeks ago. Are you sure you only had sexual contact with your girlfriend and the sex worker?
Well, doctor, actually, I had one more.
Ravi, you said you only had sexual contact with your girlfriend after the sex worker.
Sorry, doc. I think I did not know that it's more important. Besides, she was an ex, and I'm very sure she is clean. She never mentioned that she had some infection.
Well, when was your last contact with this person?
About a week or less ago, doctor.
These encounters are not far apart. Could there be trouble in paradise with your girlfriend?
Yes, doc. I'm very sure. Well, yes, doc. I admit that I've been a little apart because of our fights.
I see. So only the three of them, Ravi? Is it final?
Yes, doc. I'm sure this time there's three of them that I had contact with.
Okay, I hope you understand why I need to know this information, Ravi. Because based on your history and your physical examination, we may be looking at an infection that you got around a week ago. Remember, you mentioned that you had unprotected sexual contact with a sex worker and had sexual contact with a person suspected of having an STI. Couple that with our findings from my examination, and we have our current initial diagnosis, which is genital herpes.
Oh, okay, doc. I understand.
So now what we will do is we will treat your lesions with antivirals, okay?
Okay, doc.
Ravi, this may come as a shock, but according to your laboratory results, you may also be HIV positive.
Shucks. Is that true, doc?
But we will have to make sure. We will send your sample for confirmation test to be done, and then we will contact you once the results are in. Our main concern right now are your herpetic lesions. We will treat those first. For now, what I want you to do is to cease all sexual contact until your results are in and until you are clear from your current herpetic infection, okay? Is your significant other outside?
Yes, doc.
I will also need to include her in our counseling session. Please recall all of your sexual partners after your contact with a sex worker and have them visit a gynecologist as soon as that they can.
Yes, doc. I will contact them right away. Thank you, but this may take time. I am really not ready for this or for her to be disappointed.
I understand. But for now, I want you to emphasize, I just want to emphasize the key risk reduction strategies that will help you remain HIV negative should your confirmatory test be negative. Important to remember, you should choose less risky sexual behaviors, okay?
Okay,
As
doc.
much as possible, reduce number of sex partners and use condoms consistently and correctly. More so, get tested for HIV together with your partner, and if the partner is HIV positive, we encourage you both for treatment.
Okay, doc. Thank you.
No worries about that. It's my duty to raise awareness regarding this matter, to assure you that, to assure that you understand the things I said regarding HIV infection prevention. Could you at least tell me the things you need to do to avoid acquiring the infection?
It is important that I practice safe sex whenever I do it. Of course, I am now being cautious because of my horrible experience. I do now want to not to repeat the same mistake. I regret being drunk and careless.
Oh, I am glad that you were able to understand the things, Ravi. About HIV prevention. At least you are now aware about the risky behavior you've done before, and now you are ready to change for the better.
Yes, doctor, I will.
Do you have any more questions?
Nothing more, doc.
Okay, Ravi. I just want you to inform your previous sexual partners, and we will call you once the results are in.
Okay, doc, I'll contact them.